And first and foremost, so it does seem that England is headed to lift all restrictions, or most restrictions rather, in a few days.
Yes, thank you for having me on the show once again, Gargi. It does seem like that, yes. And I think the reason for that is that if you look at the numbers that have gone up, 24,000 cases, as you mentioned, daily, that's a 181% rise in the last 2 weeks due to the Delta and the Delta Plus variant that is now the prevalent variant in the United Kingdom. However, if you look at the graph and you compare it to December 17th, which is the last time we had 24,000 cases, you'll see that the hospitalizations and the deaths are very, very low at this point. And I think a lot of that has to do with the vaccination that has happened in the UK. As you said, 60% and more of the population has been vaccinated. And Public Health England just released a study saying that if you have had 2 doses of the Pfizer or the AstraZeneca vaccine, the chances of hospitalization go down by 92%. So at the moment, we're seeing high numbers of cases, but we're seeing mostly cases that do not require hospitalization, and the deaths are steadily increasing very, very slightly, but not at the rate that we saw in December. And I think that officials are taking that into account. Now, we have to wait and see how that number goes up, and if it goes up at all, and whether these vaccines have some sort of resistance to the effect of the Delta virus. And I think that remains to be seen. But at the moment, things look like the vaccines have made an effect.
Right, and 19th July is when, we're expecting that the announcement will be of lifting all restrictions. But what are the concerns that remain, and what about schools? What is the thought there, and what are the indications from the government?
I think schools are the main concern, and I think young kids and young population are the main concern because they have not been vaccinated yet. And the UK just recently opened the vaccine to everyone above 18. And now they're planning to go ahead with vaccinations for the younger population as well, because as we know, the Delta variant affects the young more than it affects the old. And we saw that in India. We're seeing that now in South Africa, who have just gone into a new lockdown for their 3rd wave. So I think we have to be cautious. We have to be careful. I personally do not agree with the fact that all restrictions should be lifted at once. I think that the delay from June 21st to July 19th already caused a 50% decrease in the rise of infection. So social distancing, mask wearing are restrictions that should be in place until we have a complete hold on this virus. However, it remains to be seen if the UK will do that. Economic concerns, travel concerns, there are international sports events going on in the UK at the moment. So there's a lot of things that are weighing on the government's mind, but the NHS is cautious.
Right. In fact, you talked about travel, and across the world, across Europe as well, the Delta variant is gaining more ground and more cases are being reported. So that's going to be very interesting, or rather concerning, going forward as to how, to control the movement, and where you see spikes and how to, suppress numbers. But as you said, it's vaccinations that is the way out, and UK doing very well, but other parts of Europe aren't doing so well when it comes to vaccinations.
And I think that is the tricky part in opening up travel. If you have a nation that is now vaccinated close to 60 to 70% of the population, and you open up travel, and then you have people coming in from various countries that may or may not have completed their vaccination, although there will be restrictions in place for that. But, the mixing of populations, the entry of new variants, we know that the Delta variant entered the United Kingdom in 4 or 5 days at the time that the UK took to close down flights from the subcontinent. And I think that it just takes a few days nowadays for a variant to cross over to another part of the world. So that is the main concern in opening up travel. And that's why the UK has largely been closed to the rest of the world for the last year or so.
All right. And when you talk about, the last restrictions to be lifted, what exactly are we talking about, if you could explain to us?
Well, the plan is that they're going to restrict all restrictions, which is mask wearing, social distancing, the restrictions on numbers of people within a closed setting, and it'll just go back to life before the pandemic. Now, how much of that is going to happen is still to be known. I think Boris Johnson is going to make an announcement on the 12th of July, and he will be laying down the roadmap for that opening of restrictions. But as you know, the Health Secretary of the United Kingdom has recently been changed. And I think that his ideas might be different to the previous ones. So it remains to be seen how far we go in terms of lifting the restrictions, but it will be interesting to see what happens once those restrictions are raised.
And time for us to slip into a short break. On the other side, we'll have Dr. Veer Pushpak Gupta back to answer questions that are asked about vaccines and COVID. Stay with us. Now for our special campaign, Vaccinate India, in partnership with Google, where we discuss questions that many of you have about the vaccines, about coronavirus, and questions that you often look up online and Google. And we're joined by Dr. Veer Pushpak Gupta from London. Thank you for staying on with us, Doctor. And one of the questions that people still ask, I know it's been many months of the vaccination drive in India and in different parts of the world, but people still want to know, are COVID vaccines effective?
Well, yeah, that is what is on everyone's mind, because that is the first thing you think of when you go and get the vaccines. And I think one has to only look at the graph in the United Kingdom, if you Google the graph on United Kingdom, to see how the deaths versus the hospitalizations have done in the second wave compared to what is happening right now. And I think that would give us a good idea. As I said, if you take one date on that graph, 17th of December, compared to today, which is a date that had equal number of infections, 24,000 infections per day, and you compare it to the deaths and hospitalizations on that day versus today, you will be able to see how vaccines have been effective. And that is the only reason that we are even thinking of opening the country this month, because of the amount of effect that vaccinations have had. And I think that's the only way to prevent a third wave in India, is to vaccinate as many people as possible.
That's right. And people also then, get into discussions about the efficacies of different vaccines. You have the AstraZeneca here, Covishield, you have Covaxin, we have Sputnik, and hopefully we'll have other vaccines soon. What do you think about such, scrutiny of the effectiveness of vaccines? There in the UK, you also have Pfizer as well as AstraZeneca.
Yes, and I think a lot of the data that we have is AstraZeneca and Pfizer. Although we use Moderna, and I think Johnson & Johnson has also been approved here. So the data that about AstraZeneca is the main one that will concern India, because that's the vaccine that is being used in India. We don't know much about Covaxin, but I think Covishield is shown to be quite effective, and it has shown to decrease hospitalizations by 92%. Specifically in the Delta variant. That was the latest data that was released by Public Health England. So that alone should give a lot of confidence to people, and in the public health setting should give a lot of confidence to the people giving the vaccine as well, that this could work to prevent a third wave.
Right, absolutely. And some people wonder, why are you then having these breakthrough infections? Because, we need to explain to people that while vaccines are effective, it's not 100% guarantee against getting an infection, but it will help in preventing hospitalization, which is the example you're giving, isn't it, from the UK?
Yes, and this is what I tell all my patients as well. Getting a vaccine does not protect you from getting the virus. I think the virus you'll be protected by the virus if you do basic hygiene measures and keep your own hygiene well. But if you get the virus, you have less likelihood of getting hospitalized and then being escalated to ICU care. And I think that is the most important thing. I don't think coronavirus is going anywhere. I think it's going to be in our population for the next hundreds of years, and it's going to be spreading just like the flu spread. But just like the flu doesn't cause people to get into the ICU and die as regularly as it was happening with COVID, I think the vaccine should be able to protect us to have a less exaggerated infection.
All right, Dr. Veer, another question that people often ask is, are there side effects of the COVID vaccine?
Well, the most reported side effects of the vaccine are pain at the injection site, fever, and sometimes headache or flu-like symptoms, which resolve usually in about 48 to 72 hours in most people. Now, a very, very few amount of people in the UK and in Europe experienced some very rare blood clots with the AstraZeneca vaccine. They were mostly seen in younger people with already pre-existing concerns of getting blood clots. So the numbers are extremely low. They're even lower than the general risk of the population of getting blood clots in the brain. So I think that is the reason why AstraZeneca was kept a little bit under scrutiny for the last few months. But in terms of protecting against COVID, I think it's still a very, very effective vaccine, Covishield. And the risk of getting a blood clot with COVID is much higher than the risk of getting a blood clot with the Covishield vaccine.
All right. Well, thank you so much, Dr. Veer Pushpak, for speaking to us.